Have you ever wondered if mental illness is strictly just a biological issue? Something entirely bound to our genetics or brain chemistry? It's a super common perspective. But what if the physical spaces we live in, the wealth we have, and the communities we build are actually the primary architects of our mental well-being? Today, we're going to challenge that purely biological view of mental health. We're exploring the massive, undeniable impact of our environments and talking about how we can start living more intentionally to reduce the very real, highly modifiable risk factors all around us.
The research we're diving into uses this truly powerful metaphor. It describes poor mental health as an invisible hand that suppresses life chances. Think about that for a second. It's not just a personal struggle. It's deeply tied to social inequities that act like this invisible force holding people back, and honestly, even dictating how long and how well we live. Welcome to The Explainer. Today we are breaking down the actual root causes of mental illness, what researchers call the social determinants. And more importantly, we're going to look at the proven, evidence-based ways we can intentionally design our lives and our societies to stop these illnesses before they even have a chance to start. Okay, let's look at our roadmap for today. We'll be covering 1. The mental health crisis. 2. The root social causes. 3. The prevention paradox. 4. Intervening early in life. 5. Fixing our environments. And finally, 6. A roadmap for justice. We're basically going to zoom out from the individual right up to the household, the neighborhood, and then society at large. Part 1, the mental health crisis and a system completely under pressure. We really have to acknowledge the rising tide of psychological distress we're seeing everywhere right now, especially in our youth. The research shows our clinical treatment services are just overwhelmingly backed up. In some places, a massive surge in referrals over the last few years has been met with only a tiny fraction of funding increases. The system is stressed to the max. And get this, here is a completely striking statistic from the research. 50% of all mental disorders actually begin by age 18, literally half. This just absolutely establishes the urgency of addressing this crisis early on. Adolescence is this critical period of neural and psychological development, and right now we are seeing rapid increases in self-reported depression, anxiety, and self-harm among teenagers. We can't simply treat our way out of this after the fact, right? We have to look at the causes. Which brings us to part 2, the root social causes, looking beyond biology. The data makes it crystal clear that our mental health is inextricably linked to our life circumstances. The distribution of money, power, and resources actually shapes our mental health far more than we typically realize. Things like poverty, neighborhood crime, and social isolation, those are highly modifiable risk factors. And you see, these structural factors actually compound, starting from the prenatal stage all the way into adulthood. It's an interconnected cycle. So maternal stress and poor nutrition early on can cascade into childhood adversities like family discord, which then snowballs into adolescent issues like bullying, loneliness, and eventually unemployment. So here is the crucial point. Removing childhood adversity could hypothetically prevent nearly 30% of all adult psychiatric disorders. Almost 30%. That is an astonishing number. By intentionally addressing things like household dysfunction or economic hardship when kids are young, we're looking at a massive structural prevention of mental illness in adults. Understanding that leads us perfectly into part 3, the prevention paradox. This is a fascinating epidemiological concept from Jeffrey Rose, and it completely flips how we think about preventing illness. It challenges the standard clinical idea that we should only focus our limited resources on the people who are at the very highest risk. When you actually map out the distribution of risk across a population, you find something super surprising. Most actual cases of a disorder don't come from that tiny group of people sitting at that extreme high-risk edge. Instead, the vast majority of the population sitting right in the middle, the ones at moderate or slightly above average risk, they actually generate the highest sheer number of illness cases. So, what's the solution? It lies in shifting that entire bell curve of the population's risk to the left. By intentionally lowering risk factors for everybody, even just a tiny bit, we actually prevent far more illnesses overall than if we just exclusively targeted that high-risk minority. It's a total revolution in public health thinking. This really boils down to contrasting two approaches: individual clinical care versus primary population prevention. Clinical care is reactive, waiting until individuals are sick and then treating them. But primary prevention, that is proactive. It involves using intentional social programs and community design to stop the illness before it ever even starts, across the entire population. Now, to see what primary prevention looks like in the real world, we go to part 4, intervening early in life. If we seriously want to break the cycle of mental illness, we need to zoom back into the micro level. The research highlights incredibly specific, evidence-based solutions that actively interrupt these intergenerational cycles of disadvantage, and the earlier we jump in, the better they work.
Perfectly timed interventions make literally all the difference. Prenatally, programs like monthly nurse home visits drastically reduce parental stress. In childhood, cash transfer programs that intentionally lift families out of poverty measurably reduce things like childhood anxiety and acting out. And moving into adolescence, parenting and family support programs are proven to reduce disruptive behaviors. These are intentional, structural choices a society can make.
And the results of these early actions, they're undeniable. The compounding benefits of these interventions span multiple areas of a person's life. For instance, children whose mothers received those nurse home visits showed way better emotional regulation, drank less alcohol later in life, and had noticeably reduced future criminal activity. These programs practically pay for themselves in long-term cost savings to society way before the child even reaches adulthood. But we have to zoom out a bit further for part 5, fixing our environments. It's absolutely vital to understand that our physical and social surroundings directly shape our minds. If we want to live intentionally and reduce mental illness, we have to look really closely at the physical spaces we inhabit every single day. Researchers compared different environments and found that structural changes are a total game changer. For example, a major trial in Philadelphia showed that simply planting trees, removing litter, and greening vacant lots measurably reduced depressive symptoms among the residents. Just planting trees. Similarly, providing housing vouchers to move families out of high-poverty neighborhoods significantly reduced distress and anxiety. Better environments literally build better mental health. We also see the amazing power of environment in our schools. Proven structural solutions like the good behavior game significantly reduce conduct problems. And perhaps most remarkably, the SEYLE's suicide prevention program, which basically trained teachers as gatekeepers and boosted mental health literacy, literally halved suicidal thoughts and attempts in its massive European trial. Cut them in half. Intentional environments save lives. Ultimately, bringing all of this together requires Part 6, a roadmap for justice. The source material strongly concludes by framing these public health interventions not just as nice-to-have medical add-ons, but as fundamental matters of human rights and fairness. To meaningfully reduce mental health crises, we have to rebuild society with these core principles in mind. The researchers lay out some fantastic primary recommendations for action. They urge policymakers to fundamentally prioritize poverty alleviation and structural fairness. They recommend investing in cross-domain solutions, meaning recognizing that fixing a housing issue is also fixing a mental health issue. And crucially, they argue we must ensure parity of funding for primary prevention. We need to put just as much weight and money into stopping illnesses as we do into treating them. All of this is perfectly captured by the WHO Director General, who emphasized a global commitment to transforming the environments that influence our mental health. It perfectly encapsulates this vital shift from a purely clinical, biological model of treating the individual to a much broader structural, environmental model of lifting up the whole population.
Which leaves us with this final provocative question. What kind of society do we actually want to build? Once we realize that mental illness isn't just in our heads, but it's in our neighborhoods, our schools, and our social structures, we are empowered. We can intentionally design a fairer, more connected, and mentally healthier world for everyone. Thank you so much for joining me for this explainer, and I highly encourage you to look at the communities around you today and see where that intentional design can start.